Neurofeedback is a 21st century intervention. It enables us to help people who have problems by changing the electrical activity of the brain. The electrical activity of the brain is brought about by the firing of the cells of the cortex, which are called neurons. When a neuron fires, it produces a tiny amount of electricity. That electricity is actually measurable from the scalp. It amounts to about 1/1,000,000th of a volt. When neurons work, they tend to work in enormous ensembles, tens of millions of cells firing all at the same time. Depending on what we're asking the brain to do, the firing of those cells occur at different speeds. For example, when we're in deep sleep, the neurons will fire at a very slow speed, about 1 to 4 times a second. On the other hand, as you're listening to this video and paying attention to it, in all likelihood, the neurons in your brain are firing at a rate of 13 to 20 times per second. Neurofeedback begins with assessment. The assessment occurs when we place a cap on an individual's scalp and we begin to measure the electrical activity at 19 different locations. Once we have recorded that electrical activity, we then analyze the activity and submit the information to a database. The database is made up of a sample of people as young as 2 months of age, as old as 80, men and women, right-handed and left-handed people. The recording of the EEG is then compared to someone of similar age, handedness, and gender. That comparison enables us to produce what's called a brain map. The brain map then tells us how well that individual's brain is functioning, both in terms of frequency patterns as well as in terms of communication patterns. We are then able to determine the extent to which that individual's electrical activity is within or outside of normal limits. Based on that assessment and the brain map that we produce, we then can identify those areas of the brain that are the most different from the norm. And that leads us to step 2. Step 2 is treatment. In order for us to change the brain's electrical activity, we ask the individual to simply sit still. We attach a couple of sensors to the scalp, and the individual gets to watch a movie. The movie will play brightly as long as the individual's brain is moving toward the norm. As the individual's brain moves away from the norm, then the movie will darken. The continuation of the movie, the brightness of the movie, acts as a reward to the brain, and over time, the brain will begin to shift its electrical pattern toward the norm. As the brain moves toward the norm, problems and symptoms begin to disappear. For example, the person who has trouble paying attention will be able to focus and maintain attention over sustained periods of time. The individual who is anxious will begin to feel calmer, and the person who is depressed will feel more positive in their outlook. Neurofeedback as a technology is a non-invasive approach to change. It has very, very few side effects. The changes are long-lasting, and people report that their lives are much better off for having done the treatment.